How do you diagnose it?
So the diagnosis is made clinically, so it's made typically upon physical exam and upon history taking of the patient. A lot of times rosacea can be confused for other types of skin conditions, such as, for example, lupus or an allergic type of dermatitis, but it's usually a clinical diagnosis. Now, very rarely do we perform biopsies of the skin. If we're ever questioning that something might be rosacea versus lupus, then yes, we do have to go and perform a punch biopsy of the skin, but that's rare. It's usually on clinical diagnosis, just seeing the patient and their history, what they're saying on history, their signs and their symptoms.
Who diagnoses rosacea?
Mainly a dermatologist. Primary care physicians are also, well educated in rosacea and can potentially make a diagnosis as well, but the dermatologists are the experts in making the diagnosis.
And does the dermatologist have to examine a patient while there's a flare-up?
You know what, not necessarily. Sometimes, and again, because rosacea has so many different variants, some patients just have a very mild form of it, and they do present to us sometimes with, maybe some very mild redness in the skin, but that's about it. But upon, history taking and asking them, okay, tell me about your symptoms. Do you get the flushing? Do you get the acne breakouts? A lot of times we make this diagnosis based on what the patient is telling us, not necessarily what we're seeing that day.
And you mentioned earlier fair skin. Why is it?
So fair-skinned patients are more sun sensitive, and again, sun being one of the most common triggers for rosacea, that's why they have an increased incidence.